Again, thank you so much for joining us here on Idaho Today. As the weather turns warmer, most folks will start to spend more time outside. May is Skin Cancer Awareness Month, and skin cancer is one of the most common types of cancer, but also one of the most preventable. By raising awareness and taking preventative measures, we can significantly reduce the number of cases of skin cancer. So we chatted with Dr. Amber Taylor from St. Alphonsus to learn more about prevention. Dr. Taylor, May is Melanoma and Skin Cancer Awareness Month, and for what I understand, Idaho is actually one of the highest ranked states when it comes to skin cancer, according to the CDC. So tell us, what are you seeing in your office, and what are your concerns?
Yeah, thanks for asking. You're absolutely right. Idaho is one of the most prevalent states in the nation for skin cancer.
Wow.
Over the last 20 years, we have seen a marked increase in the rate of new skin cancers developing, particularly in the state of Idaho. And that certainly has been reflected in our practice over the last 10 years.
Okay, and is there a certain reason why Idaho is, would you say?
Good question.
Yeah, just lack of prevention, which we'll talk a little more about in just a little bit. But when it comes to those signs, though, I want to know, what are some of the red flags that people need to be aware of when it comes to the pre-cancer signs, maybe even just cancer itself?
So anything that's new or changing, the skin is an organ that everybody can see. And in the spots you can't see, hopefully you have a loved one who can check for you. We do have the ABCDEs of skin cancer awareness. So asymmetry, a border that's irregular, any particularly dark colors or changing colors in a mole, the diameter if it's particularly large, or evolution. So anything that's changing, you really should ask your healthcare provider to take a look at.
Okay, so a mole that maybe you've had for years that you're just like, yep, it's just a mole, and then all of a sudden one day you look at it and you're like, well, it looks kind of blobby. If that it's changing. If anything's changing or different, or even like in your skin texture changing.
Yeah, and remember, it's easy to get a skin biopsy. Those are really low risk procedures. They're painless, if you use local anesthesia, done in most office settings. So the question's always worth asking, is this something that I need to be worried about?
Yeah, and I mean, like you said, it's easy, right? It's easy to make a doctor's appointment. Better safe than sorry, because what could happen if someone doesn't take action soon enough?
Yeah, we do see some fairly advanced skin cancers in our practice. When somebody has an advanced skin cancer, depending on the type, it could involve more extensive surgery to remove it, or potentially systemic therapy if the cancer is spread elsewhere in their body. So catching skin cancer at its earliest stages is absolutely preferable.
Mm-hmm. And like you said, the skin is an organ we can all see.
Yes.
And it's on the outside, so pay attention to it.
Yeah.
Yes. Are there certain risk factors that make somebody more likely to develop skin cancer than others?
Pale skin, which in Idaho is more common, the most common type of skin around here, so that's certainly a risk factor. The male sex has a predilection to skin cancer, slightly biased, although I will say both sexes easily can get skin cancer. Sun exposure is the #1 preventable risk factor, so, and it's a cumulative lifetime sun exposure, so that's what we like to focus most of our prevention measures on.
Okay, so you already said prevention, so skin cancer preventative.
Yes.
We can avoid skin cancer. Or most forms of.
I think that most forms of skin cancer you can avoid with prevention and early detection. Yeah.
Okay. And how do we prevent it?
Sunscreen.
Sunscreen.
Yes.
That's simple.
SPF 30 or greater.
That easy.
Sun hats, sun shirts, sun avoidance.
Sun avoidance.
Don't go to tanning beds.
Don't go to, okay, all right. So those are all very simple things that really add up. And I want to ask too, skin cancer in children, because you said that it's a cumulative exposure to the sun, which I'd imagine begins at an early age, right? So as parents, do we need to be aware of how we're protecting our kids?
Absolutely. Skin cancer isn't as common in children, although it certainly can occur. I think more than anything, though, we want to teach our children good habits so that when they become adults, they are aware of what the risks are out there. It is alarming that in the past 20 years we've seen a rise in the incidence of new cancers, and who knows what the future holds for this disease. We have yet to figure out an absolute answer for this.
Yeah, but again, prevention is a really big part of avoiding this type of cancer specifically. Yeah. Where can people go for more information?
So stalphonsus.org has a lot of resources online, or ask your healthcare provider.
Wonderful. Thank you so much, Dr. Taylor.
You're welcome.